Welcome to TriStar StoneCrest Medical Center. Here at TriStar StoneCrest Medical Center, we take our patients very seriously and we want them to be safe. We've taken certain measures in the process to come to our hospital that have changed. I will remove my mask when there's social distancing and at different parts of this video. I'd like you to walk with me through the process of coming into our hospital and what has changed. Come with me. Here at StoneCrest, the first thing that you'll encounter that's different is that we have two places of entry at our facility, each of which is monitored. When you first come in, there'll be a screener. They'll be taking your temperature, asking history, and offering you a mask if you don't already have one.
Good morning, welcome to TriStar StoneCrest. You here for surgery today?
I am.
Any fever, cough, shortness of breath?
No.
Any exposure to known coronavirus patients?
No. A no-touch temperature technique allows us to get the information, will be monitored and identified that we've had appropriate intake and move on to the next step.
Thank you.
Thank you. Once you come into the registration area, you'll notice some things that are different. We limit the number of patients that come through. We have removed all one-touch items, magazines, toys, things of that nature. All in an effort to minimize exposure. The change also involves the limited number of patients, family members that can accompany them. From the registration process, then we go back to same-day surgery. As part of our preoperative process, the patients will, a few days before their surgery, go through PAT, pre-anesthesia testing. That interview process will determine the risk and determine whether testing for COVID will be done. Those results will be completed prior to the day of surgery. Once the nurse escorts you from the waiting room to your same-day surgery room, you'll come into the room with your family member. Here in the same-day surgery room, you and your family member then feel safe to be able to remove your mask. The preoperative preparation will take place, and the nurse from the operating room will then escort you back to the surgical procedure. This is one of our operating rooms. This particular room is not special in any way. It is just an opportunity for you to see all the things that we have done to enhance the protection of our patients. And so the surgical procedures that we offer extend from orthopedic, general surgery, advanced robotics, laparoscopic, as well as endoscopy. There are certain procedures designated by the CDC as more at risk, and our personnel have the PPE, the personal protecting equipment, to allow them to perform those procedures. HCA overall has enhanced their supply chain to ensure that all of their providers have the necessary equipment to perform their procedures. In this operating room, we clean the rooms after every procedure, as we always do. At the end of the day, there's a deep cleaning that is performed to ensure that in preparation for the next day, that the patient will be safe. Once our patients leave the operating room, they're then escorted with the operating room nurse and anesthesia to our recovery room area. There, they will allow to emerge from anesthesia in preparation for returning to the same-day surgery room that was started in. Once we leave the recovery room, we come back to the room in same-day surgery. If the patient is to be admitted, they will then be escorted to a room upstairs where their family member will be waiting for them. The remainder of the time here, they will be allowed to have the checkout process and questions answered. All the effort that we've made to ensure that our patient safety is recognized, that our staff is constantly updated on the CDC recommendations in an effort to make your visit at TriStar StoneCrest Medical Center safe. Thank you for your time and your visit. Stay safe.